I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to today's IDD Health Matters Podcast. I have a very special guest today, Lorene Reagan. So Lorene and I do work together, and it has been a joy and a pleasure working with you.
Thank you.
I'd love for you to start off by talking about how you came into this field. Give us a story.
Well, this is my 40th year in IDD nursing, and I came into the field almost by accident, I think like most developmental disabilities nurses do, where I thought it would be fun to take a job in a school for children with intellectual and developmental disabilities, and that was back in 1984, and I haven't looked back.
So you kind of fell into the field like many of us do. I think there's kind of two ways. People fall into it, or they have a connection from maybe a family member and decide they want to work into that field. I fell into it as well, too, as you know. So you've done a lot in this field. Talk about some of your background and some of the things you've done along the way.
Well, I've had a lot of fun. So my career started really in clinical nursing and developmental disabilities nursing, working in group homes and working directly with people and their families. And then I decided that it would be nice to try working at a job at the state level. And so I started as the nurse coordinator for the New Hampshire Department of Health and Human Services. And over the years, had lots of wonderful opportunities and worked in administrative roles and took a few breaks from service in the state. I worked at the Board of Nursing in New Hampshire for a couple of years. And then also at the 15-year point, decided to go work at a managed care organization. That was a great opportunity. And then in my 20-year tenure, ultimately served as the Director for Developmental Disabilities Services in New Hampshire before retiring.
How long were you retired for?
For one day.
That's what I thought.
As you know, one day. So I retired for one day and then was a principal with a National Medicaid consulting firm. And did that for 4 years, and then had the good fortune about a year ago to come to IntellectAbility.
Well, it was our good fortune for sure. I mean, that level of experience is unmatched. I mean, it's fantastic, and you're such an asset to this field and what we do, and we're very thankful to have you.
Thank you. Now,
one of the things that we talk about a lot is health equity for people with intellectual and developmental disabilities. And, we talk a lot. We're going to stay more on the positive side, but sometimes we have to talk about some of the challenges. So what are some of the challenges that you see in this field that result in maybe a different level of care for people with intellectual and developmental disabilities than maybe where we'd like it to be?
Well, as you know, we have serious problems in terms of health inequities for people with intellectual and developmental disabilities. And that stems from a number of factors. It's a pretty complex challenge, I think. A number of different things contribute to this. So I think clinicians are not comfortable supporting people with intellectual and developmental disabilities.
And there are studies that confirm that.
We know this. People with intellectual and developmental disabilities are much less likely to receive the preventive care that they need. They are also much more likely to have chronic comorbid conditions, medical conditions that go untreated often for a lifetime. And as a result, the health of people with intellectual and developmental disabilities is not as good as it could be.
Yes, I echo that completely, which is a big reason we do what we do and why we work in this field, which has its own challenges, but also has a lot of blessings.
Mm-hmm.
So what are some of the successes that you've had in your career and your work that you can talk about? Some positive things that you've seen, some positive movement that you're seeing now that's working to improve the healthcare system for people with IDD?
I think a really pivotal point was when our system moved from an institutional to a community-based system of supports and services. It was also at that same time that families were no longer encouraged to bring their children to institutions and rather supported to keep their children at home And we've seen some wonderful outcomes from the supports and services that families provide to people with intellectual and developmental disabilities. So that's a huge positive. Developmental disabilities nursing has evolved. And I'm thinking back. So we're at the DDNA conference, and I was at the very first one 31 years ago. So a lot has happened in that time to really, I think, elevate the role of developmental disabilities nurses.
Including, didn't you almost have a mishap?
I may have fallen off the stage at the St. Louis conference. I may have fallen off the stage. That was brought up at this conference again.
We can cut this out if you don't.
That's
want to
okay.
talk about it.
It's totally fine. It was just a little misunderstanding about where the edge of the stage was.
It happens. It happens.
And where I needed to be, but that's okay. I'm reminded about that at least once at every DDNA conference, and that's okay. I have a well-earned reputation of falling in public.
Well, you recovered wonderfully.
Yes, I did, thankfully. But the other thing I think that's really important that's happened in the past year, and in 2022 in particular, is we've had really the issues and concerns around health equity amplified. So amplified first by the National Council on Disability, bringing forward the framework for health equity for people with disabilities. And then we saw the Joint Commission issue a Sentinel event alert on diagnostic overshadowing, in particular for people with disabilities. And then at the end of 2022, we saw the World Health Organization come out with their report on health equity for people with disabilities. So I think the momentum is there, and I think we just really need to stop talking about it and start doing something.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escude, President of IntellectAbility. State developmental disability agencies, managed care organizations, and providers across the United States use IntellectAbility's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. Yeah, I love that, and I echo that as well. I think in the past 3 to 4 years, I've seen the momentum build, and people are recognizing that we need to improve health services on a lot of different levels. For people with intellectual and developmental disabilities so that they have an equitable level of health care. Mm-hmm. And equal doesn't always mean equitable, does it?
It does not.
Yeah. So like if every office has a scale to weigh someone, well, everyone has equal access who goes to that office to be weighed. But is it equitable? Can everyone actually be weighed? Well, what if you can't stand up on the scale? Then you cannot actually be weighed. So equity involves having the same services available to everyone, regardless of a disability, with or without a disability. So mammograms are another example of that. So those are the types of things, and that points to kind of systemic changes and physical environment changes that need to happen. There are accessibility changes, accessibility issues in areas as well too. One of the things I'm really passionate about is education. So there are some things happening out there in terms of education. We've got a couple of organizations like DDNA that is really promoting education in this field. AAD&D is promoting physician, and dental level education in this field. General thoughts on that?
Well, I think education has come a long way. DDNA was certainly at the forefront again, thinking back, this is the 31st annual conference. So DD&A was at the forefront at a time when there was really nothing else available. We've come a long way because now we have things like the curriculum in IDD Healthcare, which is available to clinicians online and on demand. And so I think we've evolved from sort of the reliance that we had for many, many years on in-person nursing and clinician education to a place where now we have options. We can do both. We figure out a way to meet our needs for education. And really, I think today, there's really no reason why anyone who's working as a clinician in this field hasn't found a way to access the education they need.
Yep. I certainly agree with that. And I also think we still have a ways to go. Mm-hmm. I think we really need to work towards some sort of requirement to have healthcare about, or education about IDD healthcare being incorporated into health professional training programs. Do you agree?
I don't disagree with you. I'm a little less optimistic than you are that is a possibility, that's all.
Well, I'm hopeful and will continue to remain hopeful and positive and work towards it.
All right.
I believe we can do this.
All right. Okay, I'm with you.
All right. So something that we like to do here is to do what I call 3 and 3. So, and this is really you giving your thoughts, your advice, your recommendations to people who are listening about how they can work towards improving healthcare or health and wellness or supports and services or the general world of anything related to this field. So do you have some advice or some suggestions that you can offer people on maybe ways to get involved or whatever you might think? And it's called 3 and 3 because I'd like you to give us 3 suggestions, 3 thoughts in about 3 minutes. And I'm not going to time you.
Okay.
But think about some things that you would tell everyone to think about or do related to health issues in people with IDD.
Okay. Well, first and foremost, I would say get to know a person with IDD and really get to know them and their families and their caregivers and think about how you can support them to be more or better versed in advocating for their own health care supports, right? The next thing I would say is for nurses, for IDD nurses in particular, become a member of DD&A. Get involved locally with the greater community. Our keynote speaker this morning talked about IDD nurses as a member of the interdisciplinary team and really looking around and thinking, how is it that I can contribute to this team? How is it that I can support this team that includes the person and the other clinicians and do that in a way that is positive, that is helpful to the team, and that is well-informed. So that's really the second thing. And I think the third thing really is really just start paying attention to the clinical practice guidelines that are being issued for people. Make sure that you understand what the most up-to-date resources are for supporting people from a nursing perspective, and make sure that whenever you are representing a person with an intellectual or developmental disability at a healthcare encounter, that you are doing it in a way that helps to show the value that you feel for that person and know that person has, and in a way that is going to help them move forward in terms of their ability to either maintain or attain a higher and better quality health.
Those are wonderful examples of things that people can work towards and do, and I really appreciate those very much. Now, I do want to say one other little thing. You and I are doing a talk at this conference. Right. So tell everybody what it's about. I think it's important.
So, well, we're pretty excited about it. Yep. We have a panel tomorrow, and it includes a local self-advocate. Her name is Madeline Young, and she has agreed to join us for the panel to share her perspectives on what she finds helpful in terms of accessing health care. And when she's presenting to her primary care physician or her specialists, she'd like to help us to understand what she would like them to know and what she would like developmental disabilities nurses to know about her needs and her perspectives. And so really helping the nurses here that are attending this conference to understand that there's always room to grow in maximizing your ability to advocate effectively for people with IDD, and always to put the person at the center of that advocacy.
So, by the time this podcast airs, that will have been presented already, but it's an example of some of the things that you can learn by getting involved in organizations such as development, as DD&A. So if you work in this field or you know people who work in this field, spread the word.
Right.
There are so many benefits besides just learning things like what we're going to talk about tomorrow, but also just building the relationships with other people who work in this field is very valuable. The camaraderie, the ability to consult with each other and sometimes commiserate with each other over some of the challenges we face. Really has a lot of value in it, and it's very positive to see so many people come together to work towards better health for people with intellectual and developmental disabilities. Anything else you'd like to say or add?
What I want people to know is how much fun it is to work in this field. And I've often cautioned people when they come into the field, nurses in particular, don't come in unless you plan to stay, because you just won't want to leave.
You will. You're going to get hooked. There's no doubt.
Right.
It's certainly a career option, not just a job. That can be very fulfilling in many different ways.
Exactly right.
Lorene, thank you so much for your insights and sharing them with us, and for talking with us today, and for working with me.
You're welcome.
It is a pleasure.
It is my pleasure as well. Thank you.